Good evening, everyone. It is a pleasure to be with all of you tonight and sharing this opportunity and space with our amazing panelists. On behalf of NALHE TriState, welcome. A little bit about NALHE. The National Association of Latino Healthcare Executives, the TriState area, was founded just 2 years ago by an ambitious and frontrunner in healthcare who cannot join us tonight. Our focus is to really create an environment that is safe and promotes our Latinidad by sharing the contributions that we have as Latinos in the community, as well as creating a space for education and also sharing our different challenges in healthcare. So I really appreciate the opportunity to be with you tonight. And thank you to Dr. Navarra Rodriguez, Chief Medical Officer and President of ACPNY, Dr. Richard Young, Chief of Psychiatry at Queens Hospital Center, and last but not least, Mirna Velasquez, Special Assistant to the Commissioner of Consular Affairs of the New York State Department of Health. Welcome and thank you. And thank you to our audience for joining us in this important discussion tonight. My name is Maribel Castillo. I hold a bachelor's and master's degree in public administration and have over 20 years of experience in healthcare, both at the provider and the payer side. Currently, I work at Emblem Health as the manager of network, contracting and provider relations. In tonight's topic, I really had the opportunity to think about my experiences in healthcare and reflect on my trajectory from my early days in working in the hospital environment and how that really impacted me. This sets way to our conversation tonight, which is how do we prevent burnout in healthcare workers? In my experience and in my administrative capacity, perhaps I did not experience the same level of stress as our uniformed providers who day to day take care of our patients at the bedside, or even just in clinic settings. But I have to say that working behind the scene in different areas and really working the logistics during major disasters that impacted our country and state in the last 22 years, from COVID to Sandy and to the latest threat, COVID, had really made me aware of burnout and how it affects us all. And perhaps we need to take a closer look at how COVID had impacted us all. Maybe we need to realize that if we really are honest, we can identify that at least one person we know has passed or died because of COVID. Not only COVID, but also we have a new trend that is impacting healthcare. The fact that many healthcare workers are leaving the workforce because of exhaustion, loneliness, and really what COVID did to us, it created some sort of anxiety and separation many times from families because of the long hours that our healthcare workers had to endure in the healthcare system. So today, our goal is to really create a sense of awareness that burnout does exist, how we can create a cycle, how we can break the cycle by identifying early signs, learn what organizations are doing to address burnout, and what can we do to ease the stress of working in the healthcare segment. In addition to that, we will learn about some of the rights that we have as employees. I want us all to take note that no role in healthcare is less impacted. Healthcare workers at all levels have different stressors, and burnout at the moment needs urgent attention. Now, I would like to introduce our panelists. But before that, I would like to remind our audience that you are muted for this session, but you will have the opportunity to ask questions in the Q&A section in the chat. I would like to start with Dr. Navarra Rodriguez. And then Dr. Young, perhaps you can follow. Dr. Rodriguez, please introduce yourself. And let's start the discussion with what initiatives have you implemented to identify the signs of burnout within your workforce?
Thanks, Maribel, and that's a great question. First and foremost, I'm Dr. Navarro Rodriguez. I'm the President and Chief Medical Officer for Advantage Care Physicians, which is part of the Emblem Health family of companies. And at Advantage Care Physicians, or ACPNY as we often call it for short, we're a primary and specialty care practice with 35 offices across New York City and out onto Long Island, with about 1,600, a little bit more than 1,600 employees, and caring for 500,000 patients in the New York metro area. For us, our focus has been on patient-centric care and coordinated care and delivering value and improved outcomes in the communities that we serve, which are diverse communities. And we, having been at the forefront of the COVID pandemic, have definitely weathered a lot of stressors that can lead to burnout as healthcare workers. And again, not just from the practice perspective. In healthcare, our work is rigorous, it's critical. We know that lives are on the line at the end. So it makes it high stakes and very hard for us to disconnect from our work, and can lead to that emotional and physical exhaustion that typifies burnout. We also know through the pandemic, what was magnified, as you mentioned, Maribel, that unrelenting stress, high degree of uncertainty, personal loss, witness to excessive human suffering, an inability to connect to others in our usual ways for relief or to relieve that stress. All of those things just magnified the effect in healthcare. And then when you layer on top of that, the scarce resources that we face, heavy workloads, lack of recognition sometimes for the critical work that we do, unclear or excessive work and high expectations, and that sense of not being able to be in control over our work environments has also led to quite a bit of burnout. And we've seen that across our workforce and across the environments and across our patient base as well. So for us as a practice and at Advantage Care Physicians, we had to make that conscious decision and really recognize that beyond being a business, we were a group, a team of caring, passionate individuals who wanted to deliver value and wanted to be impactful in the communities we serve. And many of them being Black and Latino communities with not a lot of healthcare services available to them. So part one for us, as we addressed burnout and signs of burnout, was to really connect to our mission, our passions, and our purpose. So talking every day about why we were doing the things that we were doing, what was important, and how we could impact and better the lives of others. Being able to say that over and over again, and being able to, as a team, celebrate others, call out great work, acknowledge the difficulties that we faced, but that we were a team facing those difficulties together was a big step for us in terms of addressing employee burnout. On top of that, we've started seminars and workshops for all of our employees around recognizing those signs of burnout and thinking of creative ways in our offices and in our corporate environments and virtually. How can we celebrate and make work fun? How can we, again, tie back daily to our purpose? And how do we create opportunities for team members to learn and share? So creating environments where people can talk and share their stresses, their discomfort, and get a word of encouragement from their other team members was quite powerful. Also, structurally, we know that we have to, as a practice and as a business, address some of those structural limitations. So we've consolidated operating hours to make sure teams could be together and support each other at the most productive times. We've looked for efficiencies in using our computer systems and our workflows so that we can minimize burden in administrative tasks. And we're also very conscious now of encouraging people to take downtime. So taking those paid time off, where folks may have not been comfortable doing so before, this is something we encourage widely for people to be able to disconnect, to relax, to center themselves again, and get time away from the hectic work environment so that they can come back refreshed and ready for making an impact. So for us, it's, again, that tie back to being purposeful, recognizing and being empathic about each other and supporting each other, but also taking those steps as a business to minimize those external stressors and factors that we know tie back to burnout.
Thank you, Dr. Rodriguez. That is beautiful stated. Dr. Young, what about your experience, and will you please introduce yourself?
I am Dr. Young. Maribel, thank you for promoting me. I'm not the chief of psychiatry. I'm just the medical director of a small clinic at Queen's Hospital. So my experience is that, first off, I guess, you have to educate, your coworkers about burnout, what it's about, okay? Be conscious of who may be showing signs of burnout, right? And I'm part of a bigger healthcare system, right? We have New York City Health and Hospitals, although I'm not speaking on an official capacity tonight. And at I guess they don't want to call it the system anymore, Health and Hospitals level, they have actually implemented what's called a Triple H, which is the Helping Handlers Heal program. And they have sort of different components. There's like some kind of peer outreach. They had like wellness rooms, where people while at work could like take a break and go to the wellness room and sort of be kind of somewhat pampered with food and whatever, like just to relax. Those are some of the main things that I think our system has done. But early on in the pandemic, what I noticed that was really, really helpful was, what Dr. Rodriguez said, this expressions of appreciation of the staff. Like we used to get like surprises in our office tables, like just some small gift that it wasn't even like, we're not supposed to receive, expensive gifts at the hospital, but just a token of appreciation. And most of the time it came from some company that sort of like appreciated what healthcare workers were doing. Everyone got it. And there was also a time where we got lunch, like every single day if we were working there. Okay. In our clinic, we had also pivoted towards, like a sort of like a hybrid work system. So like half of our staff would work from home 1 week, the other half would work on site, and then the next week half would work, would exchange, and I think that really helped. A lot of staff members like that, idea, and in my field, telehealth, telemental health really like exploded. Like before the pandemic, we never used telehealth. Okay, right after the pandemic, wow, we became all of a sudden like experts at telehealth. Okay, I mean, obviously there were hassles, like some. I mean, it was either on our side or on the patient side. Some people didn't have the capacity to do actual televideo. So fortunately, we were allowed to even do telephone sessions with our patients, which was quite helpful. And also for our staff, like our no-show rate of patients went down. So we didn't have to like chase after our patients, which is also quite stressful for our staff. Chasing patients is another job in itself. So yeah, so those are some of the observations that I have. I mean, we also had, in our clinic, we had staff, like leave and finally retire or leave to another state. And oh my God, that was quite stressful. I mean, I used to say I myself probably was sort of going through the signs of burnout. Like if I don't know if you're familiar with there's a Maslach inventory for burnout. You could actually like assess yourself online, and you'll see how high your level of burnout is. And I would probably say that my level was getting up there as well. And I mean, on a personal note, okay. I think what Dr. Rodriguez said about taking those paid time off, those vacations. If you look at my background, this is actually a picture of the port of Barcelona, where I did my time off as well. I think we all need that time off, and we encourage our staff definitely to take time off. We were like more, I guess, we became kinder to them, like if they requested something, sometimes some staff who were scheduled, for example, to work in the office, but they had something going on at home, and they would request, could I work from home today? Because something is going on at home. We said, sure, it's okay, as long as your patients are taken care of, so we did that.
Thank you, Dr. Young. I think both Dr. Rodriguez and Dr. Young's feedback and input have created a new question for me, which is speaking about how late of adapters healthcare workers are known for. As you mentioned, we had telehealth for quite a bit, but we never utilized it. How does it feel, or how do you manage the challenge of working with 3 different generations? Some of them may be more inclined to, technology savvy than those with 50 years of experience. And we also know that different groups tolerate burnout differently. The essence of work ethic has changed drastically. We cannot compare baby boomers to Gen Zs, for example. And there is a new trend out there right now that is very palpable, quiet quitting. Have you experienced and seen that in your environment, and what can you share about that?
Want to take that on, Dr. Rodriguez, first, or you want me to take it?
I think we both can take it, Dr. Young. A couple of pieces to that question, Maribel, is we've come to realize that workers are individuals with varying degrees of need and varying experiences. So you talk about the baby boomers versus the Gen Xers, Gen Zers, the millennials. Each individual may be at a different stage in life with different complex issues at home. So the working parents versus someone who's a caregiver taking care of an elderly or incapacitated family member. There's so much diversity in terms of the experience, but also cultural diversity within our field. And I think it's important for us as we think about being an employer or manager or engaging to recognize that everyone is an individual, and that if we want to engage our workforce and retain our workforce, we have to do that with some degree of flexibility, like Dr. Young mentioned, around, do we have a hybrid work environment? Do we need to address needs in an individualized way? I think as employers look at their workforce, having that flexibility and understanding that there's a way to be flexible, yet still drive towards a common goal and a corporate initiative or need. And that gets to that quiet quitting that you mentioned. Yes, we see it. Yes, we've seen people who are tired, who have been overwhelmed, say, for my own sake, I can only do the bare minimum. I'm not going to take on any more work. I don't want to be accountable for anything. I'm just going to do the bare minimum that I can do to get through my day. And the only way for us to combat that is to acknowledge that burnout is real, that individuals need to connect with others and have opportunities to talk through their stresses and address their needs and stresses. And for us to be flexible in knowing that for our workforce to be productive and to care for others effectively, we have to recognize those individual needs. Just like in healthcare, for us being a patient-centric practice, we want to recognize the individual needs of each patient. We also have to do that with our coworkers and colleagues and be able to create those environments for people to feel safe and articulate what's bothering them, what they're worried about, but also what gives them the passion and drive to come into work every day and highlight that and make sure they don't lose sight of what they've been passionate about in their careers and what can take them forward and get past these hurdles.
Thank you, Dr. Rodriguez. Dr. Young?
Oh my God, quiet quitting. I've read a lot about it. I think if you ask me, I may be guilty of that sometimes, every now and then. I mean, I do, I don't know. I think for me, very important is if you have a break scheduled, take that break. You know, like I've made it a habit, for example, on just my personal experience to take a walk during lunch hour, you know, step out from the clinic, you know. I encourage my staff to do that or whatever, to at least do that. I think the other important thing about is that, you know, that the staff feel like they could come to you, you know, they could open up to you, and you can, you know, like everyone is treated like family in a way. And if they have issues, you know, you are approachable if you are a healthcare leader or healthcare, you know, you are like an executive, I should say, since this organization deals more with healthcare executives. Just being open and being able to listen, you know, to your staff, and provide them the support that they need, you know. Ask them if they have any concerns, you know. I know, I mean, I mentioned that the initiative that New York City Health and Hospitals did, but that honestly, on my part, I think I may have used some of the initiatives that they did, like the wellness room, that I definitely like. Peer support, maybe I didn't quite use that, but you know, I know some of our staff members are encouraged to do that. There was a lot of promotion by email, a lot of webinars by email, and you know, I'm sure you're familiar with Zoom fatigue, or in other cases, it's WebEx fatigue. You know, where you're sick and tired of online meetings, right? And it's like tons of emails that you receive about the program, you know. Anyway, I think I'm going farther and farther away our topic, but I have a lot of thoughts about this issue. It's just I don't know.
You're
how
on
to
point,
limit
Dr.
myself and
Young.
where I should go.
You're on point, Dr. Young. I think the major takeaway is to make sure that we check on each other, to make sure that we, as organizations, implement programs, that we take advantage of those programs. And as healthcare workers, that we make sure that we check on each other. I call it the mental check. We all need a mental check once in a while. And as much as we have our secret powers within us, because we show resilience, strength, we are at the end of the day humans, and we can all feel the stressful situations and what burnout does to us. Sometimes it may be even we can even take it on our family members. And I think it's important for us to take a step back and just realize the amazing opportunities that we have in this new environment where burnout is not a secret anymore. It's out there, and there are a lot of resources online and in our facilities and organizations that we can take advantage of. But I would like to pause for a second and invite Mirna to the conversation. Mirna, I wanted to ask a question regarding healthcare workers and the shortage. As you heard, throughout the conversations, Dr. Young and Dr. Rodriguez, we are losing talent. We are losing healthcare workers. Are you aware of any initiatives that New York State is perhaps embarking in to attract new talent?
Thank you, Maribel. I think that
I'm sorry, Mirna, if you don't mind, please introduce yourself.
Yes, good evening. Thank you so much for inviting me to participate in this panel. My name is Mirna Velasquez. I work for the New York State Department of Labor. My main portfolio is to work with foreign consulates. Why? Because the immigrant community, when they come to live in the US, they tend to look for assistance with their representation with the representations from their own countries. So saying that, my main interest here is to disseminate information about our services and programs to everyone. Now, your question is, I would like to answer them in pieces, because it's not just a one straight answer. I would like to tell you that before this pandemic happened, I was aware of the shortage of healthcare workers. Before I joined the New York State Department of Labor, I worked for a member of Congress. And there I realized how often the few folks that knew about our services, they reach out to help them with the work permits. And we worked very closely with the Amherst Hospital back then. I'm talking 10 years ago. So that issue is nothing new, at least to me. I was very aware of that situation, and I learned that usually our nurses, they used to come from Philippines and those countries. So when we hit this pandemic, we were like quite concerned. Now, the New York State Department of Labor, I don't know if you were aware, but this is the main state agency that was the busiest during the pandemic. Not only because we had to deal with unemployment insurance benefits, handling all the disbursement of all other federal benefits like PUA, on and on and on. I mean, this is not the space to go in details about these benefits, but when it comes to our healthcare workers, yes, of course, and the agency was quite aware, but I don't know if you know that the agency works very closely with the Governor Hochul in this case, and that it works very closely with the members of elect at the state level. So it's not only what we do in conjunction with these other elements. So first of all, I would like to tell you what I have noticed either at the federal and state level, what is happening and why many times we don't have the results we want. First of all, we, regardless of the industry we engage, we are just like this. We are just focusing in doing our job, but we are not aware of what tools we have available. In this case, the role of the Department of Labor, when it comes to healthcare workers, is to investigate complaints made by nurses or their reps, request records, schedules, nurse coverage plan, documentations, the determine adequacy of the nurse coverage plan. I assume you know. If not, we can share information with you. Determine the validity of allegations, issue violations based on findings. To me, it's very interesting to know that very few people reach out to us when they have issues, either because they don't believe that the agency will help them, or because they don't know what the agency can do for them. So by keeping quiet and allowing abuses, that's not going to help. I'm very clear. So I will rather ask you to do 3 things at this very moment. Please subscribe to the New York State Department of Labor, so you will get information, fresh information about what's going on, not only about the agency, but also what is happening at the legislation level, what other activities are or efforts are being doing along with the executive office, meaning Governor Hochul, and of course the New York State Health Division. So as probably you may know, all these agencies work together in order to enact this any piece of legislation that be of help. Now, when you're asking me about what actions the agency is taking, I can easily go to the resolution, the pieces of legislations that the Governor Hochul, along with the New York State Department of Labor, are implementing. So, I don't want to overwhelm you with tons of information, but I can share with you at least the press releases where you can read at your own leisure. But they have enacted pieces of legislation to retain, rebuild, and grow healthcare workforce through wages, bonuses, cost of living adjustment, strengthen the career pipeline, expanded access to training and education. There, early this year, that was in January 5th to 20 this year, I'm sorry, there was an investment of $4 billion in wages and bonuses, including $3,000 retention payments to full-time healthcare workers. So if you follow the news, or at least you're just subscribed about our initiatives, you may know how much money the government at the state level is implementing in order to rebuild and try to keep on board all these all the health workers we have at this moment. Now, I would like to mention something that probably is not directly linked to what is happening now, but I don't know if you are aware that the Department of Labor has a program called Apprenticeship Program. And this is a program directed to folks between 18 and 24 years old. This program will help young people to find out what is their call. Many times, especially if we are talking about immigrants or Latino community, parents, they don't, because they lack of knowledge about how the US government structure works or what kind of opportunities we have available, they may consider to encourage their children to apply for this type of vocational training, because not only they will learn any vocational training, in this case, perhaps the nursing, they can also get paid while they learn. So in that capacity, we can, help more people to be more involved in this altruistic profession, because it is not only about money. It takes empathy. It takes the love to serve another human being. And at this moment, because we are still facing shortage, and you know what I have heard is nothing new to me. We have burnout people. I was myself sick during COVID, not because of COVID, because I had other health issues, and it was so difficult for me to find a doctor who can see me and help me to go over, you know, medication and tests I needed. So I do appreciate it. And actually, let me take the opportunity to thank each one of you for the devotion, the commitment you have with humankind. Is very, I won't say rare, because all of you who are involved in this profession had those qualities. Is at the core of your essence. So I will appreciate that you please take the time. And also I would like to share with you one suggestion. Many times people complain that it's very difficult to get a hold of a representative at the New York State Department of Labor. Let me tell you that you have also, besides my person at your service, you can also request assistance to your elected officials at the state level. You can easily contact them and request for assistance. Our office has an intergovernmental division that can help you to find easy responses, assistance to any issue you may have. And last but not least, the Department of Labor has a retaliation division. So let's say you are facing any issue with the fact that you are being forced to work overtime, mandatory overtime. If you are not happy with the way that your superiors are treating you, you can file another complaint for retaliation. You shouldn't be afraid that of that situation, because the agency will look into both complaints, the one that you have initially and the one you are filing for retaliation issues. So just be aware that the agency works for you and is there for you. And if you are having issues with getting somebody to speak about your specific problems, please don't hesitate to reach out to me. I'll be more than happy to connect you with whatever division you may need assistance with. I hope that answered your question.
Mirna, that was so much wealth of information. I will take you on please sharing the information about the linkages that we can all take advantage of, the links for New York State, as well as the programs available. I do have a follow-up question for you, and it's mainly on unions. As we know, many healthcare workers rely on union representation. Are unions excluded? Are any union action excluded? And do you still encourage any healthcare worker, whether he or she is unionized or not, managerial or not, do you still encourage them to file a grievance, an investigation with New York State? Will that be the correct path? Because in our environment, it is very well vetted in our system that the union is there to represent you. So I want to make sure that we raise that awareness and that people know that they shouldn't just rely on the union. They're there as a support, but what else is there for us?
Okay, Marvel, I regret that I won't be able to answer that question straightforward, because honestly, that's not my area of work in my agency. However, we have a division that can work directly with unions and the workers. So if by any chance you encounter any issue in this area, I'd be more than happy to connect you and get faster response, because it's not as easy as to say, oh, if your union doesn't help you, just come to us. Of course, you have to follow the path. But again, if you don't feel, and you as worker, you don't feel that you are being represented, by all means, I mean, you are not prevented from reaching out to us. But because there are, this protocol to follow, I will suggest you to, after, following up all this protocol, if you don't get that response that satisfies you, please reach out to me. I'll be more than happy to help you with that.
And Maribel, because Myrna, it just really reminded me how important advocacy and connection to our electeds and the departments and the resources are. I have to say, for us at Advantage Care Physicians, one of the great things that we heard this year was Governor Hochul's legislation supporting New York State healthcare worker bonuses. And we worked with our unionized staff to get that recognition. And I have to say, initially, as a practice that was not a hospital and not a federally qualified health system, the initial legislation had excluded us as a practice. But with the connections to the departments of health, to our electeds, with the departments of labor, and engaging with Dr. Hochul and her representation as well, that recognition was acknowledged for us as a practice. So I want to echo Myrna's point that as healthcare executives, we need to understand what resources are available to our workers, but also actively advocate for them, so that we can continue to get legislation that supports building, recruiting, retraining, and retaining healthcare workers, and making this an environment where those passionate individuals are supported and can help our workforce grow.
Thank you, Dr. Rodriguez. And for our NALHE has a reach to New Jersey and Connecticut as well. So I will invite our members from those states to also put your concerns up front, go to your legislation and make your voice heard. If there is no mechanism as in New York State, where you can raise your concerns and file your grievances. Thank you, Dr. Rodriguez. That was well said. I would like us to now share some personal tips. I know we heard about taking breaks and taking advantage of different resources in our work environment, but let's be honest, we're healthcare workers. We are the worst possible patients. We are the worst at taking time off. And we are the worst at taking those breaks that we need to. So what personal tips can you share with us that you have incorporated in your day-to-day to take care of your physical and mental health? I'm going to start with Dr. Young.
Okay, I actually came up with a mnemonic for this because that's the way my brain works. Okay, I'm a teacher by heart, with this medical students and residents in the past, more with medical students now. So I came up with this mnemonic called stress. S stands for do not forget to sleep and eat. Okay, number one, take care of your basic needs. Okay, very important. T stands for take time to clear your thoughts. So there are various ways of doing that. Things like meditation, visualization. They talk about progressive muscle relaxation. Mindful movement. Just simple breathing exercises or journaling, drawing, laughing. I was just watching earlier. What's his name? Fluffy on Netflix. I love those, stand-up comics. R stands for refrain from alcohol and drugs, perhaps. E, engaged in some form of physical activity. I know exercise is a great. To me, I consider it the best antidepressant and anxiolytic agent is exercise or physical activity. S stands for seek support from your family, friends, and colleagues. And the last S, which has been quite important for me, I think, since the beginning of the pandemic, is I call it the soar higher, spiritual and religious practice. Actually, Myrna and I, we belong to the same faith. And when the pandemic hit, we started like an online, call it an online devotional. And for a year and almost 2 years, actually, we did it. For 1 year, we did it every night. And it was a great way for us to connect and pray and support each other. That actually kept me going. Otherwise, I would have probably quit my job. to be honest. Okay. And then now we've sort of pared it down to like twice a week. So, but so that's my mnemonic: stress. Okay.
We're going to ask you to share that with us again, Dr. Young. Probably
Yeah, I'll
share that in our
I'll share it in the chat.
chat. Perfect. Thank you. Dr. Rodriguez?
Yeah, Dr. Young spoke about all of those elements. I'll admit I am a horrible patient and had to address healthcare issues during the pandemic of my own, and recognizing that life can be short and it's precious. So focusing on self-care did become a priority for me and my loved ones, and that ability to exercise, to eat right, to focus on putting my iPad down, turning the television off, and going to bed at a regular time so that I could get sleep was important. And also that recognition that I needed to disconnect from work and decompress at times. So even in the craziest environments, taking a few minutes, an hour a day to just be away from the work was critically important, and using that time to connect with loved ones and friends and enjoyable activities. The other piece for me was being able to prioritize and set boundaries, to know what was manageable and what I needed to be put to the side, and to be clear about that, to ask for help when I needed it from other people, but to be very measured in what I needed to devote my energies to, and put my heart in that, but understand that I couldn't do everything, and that if I wasn't physically and mentally well, I wouldn't be successful in any way, shape, or form and ready to care for others. So I would just emphasize, like Dr. Young, addressing that stress and each one of those elements, and focusing on that self-care to be ready to care for others.
Thank you, Dr. Rodriguez. Mirna?
I was busy trying to find more information for you. Actually, well, I honestly didn't feel the pressure of the pandemic, because what Richard said, I am blessed to live with my family. So actually it was the happiest time I have had, even though I went through a lot of health issues due to the loss of my grandmother, the one who raised me. So spiritually speaking, I think that's the most important key, because if you have that mental peace through prayer, I think that you can easily, well, not easily, but it's easy for you to go through any problem you may face. And yes, of course, all the other tips that you have shared previously are to take into consideration. But when it comes to legal services, and be aware of what it is important to me to share with you tonight. Again, I pledge, I ask you to be more familiar with what are the services you can get through your elected officials. As a former congressional staffer, I believe that it's very important for us to learn who is who out there and how we can get benefit. My call is immigration, and I was very surprised that very few people, well, in this case, constituents, I'm not talking about undocumented or documented people. People don't take advantage at all of the services your electeds provide. And when it comes to, I'm not talking about partisan politics. I'm talking about the fact that you can take advantage of the people you elect. And it's not only for you just to go to vote. And by the way, the elections are coming. It's for you to be more familiar. If there is an issue that you need assistance with, find out if that is a state, federal, or municipal level. Just to give you an example, is very simple example. Let's say your tree is growing and the branches are all over the sidewalk. call your municipal elected to get assistance with that. If you need to expedite your work permit because you are here with an H-1B or H visa, you can easily contact your member of Congress, sign a privacy release form, provide all the documentation and say, hey, this is happening. I would like you to please help me to expedite my work permit. I mean, as simple as it sounds, but those services are key. So I am a very, very strong advocate for people to get familiar about who is who at your government level, and be aware of what's going on in the sense of many people wait for others to advocate for the problem they have. And I just heard what Dr. Rodriguez said. People are waiting for unions to take the lead for you to serve or to get assistance with a specific issue. If each individual take the task to familiarize, educate themselves, you won't be waiting for a long period of time to get a decision or a solution, because all of you are involved in the process. My 2 seconds. Thank you.
Thank you very much, Mirna. That was well said. We are coming to the end of the hour. Just so that you know, we had a lot of good feedback on our chat. People are very appreciative. Our participants are very appreciative for the information. And they are requesting some of the information to be shared. So I see that. Thank you, Dr. Young, for sharing your stress release methods, and we will be following up with a couple of links for everybody to have access to. This has been just an amazing evening. I really want to thank our panelists, Dr. Rodriguez, Dr. Young, and Ms. Velasquez for being here with us tonight. I believe we have to be reminded again and again of the importance of taking that mental check and take the time to rest, recharge, use Dr. Young's stress relief methods, and don't forget to call action. We have a voice, and we have the support of the state, and we have the support of our leaders to overcome this burnout. Let's not normalize it. It's time for us to take a step back and bring again the balance in our lives. It is very important to us. It is very important to the ones that we love. And it's also very important as we are healthcare workers. If we want to succeed in what we do and give the best of us, we have to be the best of us. And the only way that we can ensure that that happens is by taking care of our personal needs, our health needs. And hopefully next year, we don't have to have this conversation. I want to thank you again for being here with us tonight. And I want to encourage our audience to join NALHE TriState. This group is an amazing group of talented professionals who really want to create this safe environment for us to share, educate, and elevate our next professionals in healthcare. Thank you again. Until we meet again, stay safe and remember, recharge and be well. Have a great evening, everyone.
Thank you. Have a good night, all. Take care.
Thank you all.
Thank
Bye-bye.
you. Thank you.